As NATO defence ministers meet in Brussels to discuss the alliance's capabilities and demands to increase defence spending to 5% of GDP, close to the Russian border in the Baltics and Poland, multinational soldiers are conducting a large-scale military exercise to determine readiness in the event of war. The evolution of critical field hospitals have been crucial as the first line of defence, preventing death or major life-changing injuries for soldiers on the battlefield. These drones are said to be a game changer for decreasing mortality rates, as injured soldiers can receive rapid blood transfusions immediately. So this part of the exercise simulates the use of drone technology to deliver blood directly onto the battlefield. Soldiers are given a blood transfusion there and then in the event of them hemorrhaging or being caught in an explosion. It just buys them a certain amount of time before they can get to a medical aid centre and to be treated properly or to get surgery. Here, medical staff react to drills and emergency life-saving treatments that are common to battlefield injuries. The patients you see here are notional, but the field hospitals are there to stabilise patients with IV access, intubations and CT scanners for head trauma and brain injuries. This is Hospital 519. It's an American-led field hospital set up in the centre of Lithuania. It's really part of NATO's exercises and readiness for war. At any point here, there are 2 to 3 surgeons ready to do about 18 hours of surgery per day with 2 operating theatres and 30 medical staff.
The patient here, he's intubated, he's suffered burns in his face, and so we have our equipment set up. We have him on our cardiac monitor. He's on our mechanical ventilator, and right now we're providing life-saving treatment for this patient who requires it to survive. It could have been an explosion, a blast injury, something that could have obstructed his airway, which requires this ventilation in order for him to breathe, ma'am.
The hospital also has an intensive care unit and a dental unit for specific war injuries, including tooth disease.
Most of the injuries we're seeing are different from that we saw in the war in Iraq and Afghanistan. Soldiers are wearing body armor and helmets, so a lot of the injuries are to the extremities and to the face, which highlights the need for a dentist on the battlefield. If a soldier has tooth injuries, either from trauma or disease, it might affect their ability to wear their helmet, and then they can't fight.
The war in Ukraine is informing how you're setting up this dental hospital within the battle?
Absolutely, yes. The U.S. Army medical leadership, both in the Army Medical Department and the Dental Corps leadership, have been studying the trends very closely to try to see how we can modernize our Army medical team to include the dental team to be better prepared for large-scale combat operations.
Senior NATO military leaders say they advise armies to conceal the medical Red Cross sign at military hospitals or medical structures, despite the fact that civilian and in particular hospital structures have protected status in international humanitarian law. However, this is no longer respected in many current wars or conflicts, they say. Shona Murray, Kaunas, Lithuania.